Sorry about that. Can you hear me now? Great. Good morning and welcome to United Way for Southeast Virginia's virtual call on mental health. My name is Dr. Dershawn Brown and I will be your moderator for today's town hall on mental health. Today we will hear from United Way's Chief Impact Officer, Tanya Adair, and Dr. Rose Moulton, founder of BLOOM Transformation Center. For those watching live, please leave your questions in the Q&A chat box, which you will find by clicking the question mark at the top right corner of your screen. The last 10 minutes of today's town hall are reserved for questions, and we will do our best to get through each and every one of them. Now I would like to turn it over to United Way's Chief Impact Officer, Tanya Adair, to say a few words.
Hello, everyone. Welcome to United Way's virtual town hall on mental health. This is just one installment of a series of town halls we are providing to connect you with information and resources you need to weather this crisis. To see our previous town halls on unemployment insurance, accessing food assistance, as well as water and utility assistance, please visit unitedwaysem.org/virtual-town-halls. The website is also included in the Q&A chat box. We know this pandemic has disrupted the community in every way. It has caused a strain for all of us, and you need to know that it really is okay to not be okay. Whether you're dealing with grief from the loss of loved one, anxiety brought on by this change in our way of life, your children may be struggling with new fears and anxieties. We want you to know there are resources available to help you. Most importantly, we want you to know that you're not in this alone. For this reason, we've invited Dr. Rose Moulton to join us today to share information and resources to help us through this very difficult time. Dr. Rose Moulton is a licensed psychologist, author, speaker, and life transformation specialist. As founder of BLOOM Transformation Center, a Detroit-based wellness center that blends traditional mental health and holistic healing, Dr. Rose offers a variety of services to assist individuals in achievement and maintenance of mental and emotional well-being. Dr. Moulton is a native Detroiter with more than 20 years of mental health experience. We are so grateful to Dr. Moulton for being here with us today to share her valuable knowledge and experience with us. At this time, I would like to turn it over to the fabulous Dr. Rose Moulton.
Mm-mm. Mm-mm.
Dr. Moten, I think you're on mute.
I'm done. Thanks a lot. I want to thank you again, Tanya, Ms. Adair, for that introduction, and I want to thank you all for having me here today. It's very appropriate if you consider that May is Mental Health Awareness Month, and we're now entering month 3 of this pandemic here in the city of Detroit, and it's been very taxing on many people, even individuals that have never dealt with any type of clinical mental health or emotional issues. They're finding for the first time that they're experiencing a great deal of anxiety, a great deal of behavioral, cognitive, as well as physiological reactions to what's going on. And I love what Ms. Adair said in the beginning. It's so important for us to let them know that it's okay right now not to be okay. And that's what we're here to talk about, just how we can navigate through these uncharted waters that we're all in at this time. At the beginning of this crisis, I shared online in a forum what I considered, and I developed what was called the 6 stages of social distancing. And if there's a chart that may go up at this, if not, I'll make sure I leave it with you guys and you can share it on your social media sites as well. But the 6 stages of social distancing, I created this and kind of going along with the 6 stages of grief and loss, because if you remember back in mid-March when all of this came on and all of a sudden, you know, this big shock to all of our just daily regular lives of just going here and there, and we're told now it's time to just shut everything down. And that was a very difficult time for people emotionally, because again, it was traumatic. And I'm not using that word in a dramatic sense, because by definition, a trauma is anything that occurs outside of our everyday experience. So when we were told mid-March that we had to kind of just end life as we know it, you know, business as we know it, socialization as we know it, it was very difficult for many people to adjust to that change. And so I developed this chart that talked about those 6 stages. And the first stage that people started to experience, and we noticed that, and there are people still now that may be vacillating in that stage, and that was this sense of just denial that this was even happening. It was a lot of individuals that just wanted to believe this would be something that would pass in a week or so, that it was being blown out of proportion. And denial is a way for us to protect our ego. It's a coping mechanism that has benefits at times, because it can protect us in our most crisis-filled times to help us navigate out of that crisis. But we were in this sense, a lot of individuals of denial, just not wanting to believe that this was actually happening. We heard things like, you know, this is a hoax, it's not true, it's not very serious. And soon it became obvious that, you know, this was as serious as just the circumstances and the rest of the world were reporting at that time. And shortly thereafter is when, especially here in the Detroit area, we started to see the loss of life. You know, people that we know, people that we may have associated with, family members, friends. And after that sense of denial, you know, when we're told, okay, let's shut everything down, there came this time of bargaining that you found people in, wanting to say, okay, maybe if I just go outside or go to work certain days of the week, or I accept so many customers in at a time, you know, I can do that. So this is, again, going along with like the 6 stages of loss and grief. We found people in this sense of wanting to bargain their way out of this new reality that we found ourselves in, of having to just be in this place of social distancing. Then following that came the anger. And the reason I felt it was so important to even share these stages is because so many of us felt it, but did not realize that this was natural and it was okay for us to feel that. So there came anger. People were angry. You know, there was a lot of economic loss. There still is a lot of economic loss that's associated with this that can be very taxing on a person's emotional and mental health as well. And what you can find is that oftentimes people will vacillate through those 3 stages for a while. So people will find themselves still in this sense of denial. We look around, we see news reports of individuals who are still wanting to live life as normal, you know, not wanting to adhere to the rules of wearing masks to protect the public and to protect themselves. You see people still in this sense of bargaining where, you know, people are carrying on with activities that they were doing prior to all of this starting, in just a sense to want to grab on to some sense of normalcy as we once knew it. And then they can vacillate back to that anger. So there are a lot of people, and if you find yourself kind of in those stages now, just know, you know, as Ms. Adair said, it's okay. It's okay because this is normal. And I want to normalize what a lot of individuals are experiencing now. So these 6 stages of social distancing, as I call it, the next is like that relapse. And again, the relapse means you're going back into this circular motion of the denial, the bargaining, and anger. And then The fifth stage is, and as a clinical psychologist, I'm seeing it more now than ever before, is the stage of depression, and it can be tinged with anxiety as well, with people who have never ever sought mental health services are now reaching out, for telehealth services because what we have experienced and what we are currently experiencing, this current crisis is far outrunning our coping mechanisms, many people find, because we don't have a playbook for a pandemic. Even the mental health community, my colleagues and I, there's no playbook for a pandemic. The last time this was experienced, none of us were on this face of the earth. So there's no playbook, and people don't know, how am I supposed to cope? Is what I'm feeling normal? There can be this, again, the sense of depression, the sense of anxiety. And then the final stage is the sense of kind of just acceptance, knowing that this is where we are now. It's not going to last forever. Things will be different for quite some time. It's very difficult for us in the midst of a crisis to even start the healing process, but it can be started. And also in this final stage of acceptance, I encourage people to start looking ahead as far as what do you want your life to look like on the other side. Things will be different for most, if not all of us. Even the way we just navigate the world, even the way we just go to the grocery store, the way we congregate with individuals. A lot of us have found that even the way we have entertained ourselves, some of the world's largest entertainers are now resorting to virtual platforms, which, has been a source for a lot of people of just comfort during this time. But to understand that if you've experienced any of these stages during this time, it's normal and it's okay. I want to also talk about how we respond to stress and trauma, because again, I'm using the word trauma not loosely here, because this has been a traumatic experience for many of us. And I'm going to stress that definition again. By definition, trauma is anything that occurs outside of your everyday experience. We were used to waking up, going through our morning routine, going into the office, having this freedom, this personal freedom to go where you please for lunch, for dinner, looking forward to the weekend, all of that. And all of that has shifted, to the point that people oftentimes don't even know what day it is. I can remember even last week, I had to remind myself, did we have Easter? Like, the time has just gone so quickly. I couldn't even remember, if Easter had even come and passed. So we're like in this bubble that we've never been before. And oftentimes we will have reactions because of this place of uncertainty that we're in. And these reactions are behavioral, they're emotional, and they're physiological as well. So I wanted to just spend a few minutes talking about some of these responses that we may be experiencing behaviorally, that we may be experiencing emotionally, and that we may be experiencing physiologically, that we may not understand why we're experiencing this. And I want to do this because it's so important for us to normalize it, and again, to stress that it's okay if you feel this way. So behaviorally, you will find people, even in this sense of social isolation, this desire to want to isolate, right? And that's kind of, you think about it, it's weird because we are already in this space of social isolation, but we find ourselves not even wanting to answer the phone. Like, typically prior to the crises, we may have had a friend or two that we talk to on a daily basis. But right now, with all this uncertainty, a lot of people experiencing loss, some people are finding just a need to even want to isolate from this type of virtual connection that we can have. Low frustration tolerance. Often people are saying that their ability to just navigate and deal with even minor stresses they found have been lowered. So there's this low frustration tolerance that oftentimes people are reporting. Overeating, or unhealthy eating habits. You're finding yourself maybe up 2 a.m. in the morning having a meal or snacking when you typically would not find yourself doing that. A sense of low motivation. Now, this is what I'm hearing from a lot of individuals who are now working from home, they will say that their desire to even get the workday done. They learned that work that they could get done in 5 or 6 hours is taking them 9 hours, 10 hours. And, so now, to add to that pressure of being at home and working from home, they're finding their work days are even longer. But again, we have been taxed. Our coping systems have been taxed. So just cognitively, we're not able to just process things as quickly as we typically would be able to, and increase risk taking. And I want to touch on that because even when we see the individuals that are out and not adhering to the social distancing rules or not adhering to wearing the mask around other folks, and we get so angry about that. But understand behaviorally that tendency to increase risk taking is part of just our response to stress. Because when our personal freedoms, as many feel, has been threatened, they want to, what we call in psychology, they want to react. It's called psychological reactance, and they want to actually just insist and assert their personal freedom and find themselves with increased risk taking. And that's, again, going out and without a mask, or finding themselves in situations or environments where social distancing rules are not being adhered to. And emotionally, anxiety, depression, feeling numb, all of these feelings of disconnected. I've heard so many people report just this overwhelming sense of feeling numb and disconnected. And again, I'm going to use that word like you're in a bubble and the life is going on around you, but it's just like you don't know where you fit. People have likened this to the Twilight Zone. Like this just feels so unnatural. So that feeling of being detached and disconnected is normal. For people, even like myself, who have lost multiple people that I've known in this sense, I've heard people who've lost loved ones report, and they'll say, I don't even know if I've started the grieving process because I just feel so numb, or, I haven't cried, or, I know this person is gone, but it doesn't feel real. This sense of detachment and disconnect is just a normal emotional response to what we're all experiencing now. And it won't last. It won't last. And we'll get to the coping strategies to make sure that we're able to process through these things appropriately so they have the least amount of emotional distress on us as possible on the other side of this. Anger, irritability, a sense of guilt. Lots of individuals who have always wanted to perhaps maybe work remotely from home are now for the first time in their lives working remotely from home. And so there's a sense of just appreciation for that. But then along with that comes the guilt because of what it required for that to actually happen, or guilt because maybe you've lost a loved one or someone that you know during this time, but you're celebrating the fact that you are working from home, or you're celebrating the fact that for the first time in your life, you've had more time with your friends and family. This is normal as well. And I don't want anyone to ever deny whatever emotions you're feeling because you feel like it's wrong. This feeling of hopelessness and helplessness, difficulty concentrating, flashbacks. So when we are faced with new stresses or new traumas, oftentimes people will report that they're having flashbacks of past traumas and past stresses. And this is completely normal as well, because when we are faced in this situation that we've never been in, our brain is attempting to just process it and figure out what do we do with this information. Our brain is trying to figure out where do we put what's going on. There's not a place in my brain for a pandemic. I've never experienced this. Even with loss. Most of us have experienced some loss of a loved one before, but we've experienced that before. So we know the process. But in this day and time, even with the sense of loss, we don't have a funeral. We don't have the viewing. We don't have, let's go visit the family. Let's take them food. Let's give them a hug. And so there's so much unnaturalness to everything that's going on that there can be just flashbacks of other traumas. Globally, what's being reported is people all over the world, because this is a pandemic and we know it's hitting every part of the world. What people are reporting in other parts of the world is just unpleasant dreams or dream states that are very disturbing. So people are waking up from sleep and not feeling rested at all because they've spent so much time just having these dreams that are disturbing or unsettling. And what I want you all to understand is that, again, this is your brain's attempt to try to process and make sense of what's going on. So you will find yourself having probably more of an active dream state that may feel unsettling afterwards. And our brains are trying to process it. Years ago, when I was trained in critical incident stress debriefing, and this was trained as an individual to go into places, be it places where there were natural disasters or places where there was maybe some robbery like banks or what have you. And they would get me in there immediately. And when I say immediately, if it was local, I'd be there within an hour of the incident. If it was someplace national, they'd get, you'd be there within a day or so. But the whole point of that was, what we knew is that the sooner that we can help a person make sense and process what has happened, that unnatural trauma that happened, the less likely it would have long-lasting psychological effects on them. And that's why, I commend you guys for doing this, because it's so important for individuals to understand the sooner, even though we're still in this crisis now, the sooner you reach out for help, the sooner and most insurance companies now are waiving copays or waiving deductibles, and, everything is telehealth now, so you don't even have to leave your home. The sooner you can start just helping yourself process what has occurred, the less likely it would have devastating or marked impact on you on the other side of this. So I want to encourage that. And lastly, physically, insomnia. People are reporting, difficulty sleeping. When this crisis first began, and I was doing a lot of interviews with different, organization and media outlets, and initially I was like, keep your same routine, keep your same sleep cycle. And, somewhere along the line, I started to loosen up on that. And I'll tell you why. Because again, we are in a place we've never been before, and everyone's not going to be able to keep that same sleep cycle. And I don't want a person becoming overly anxious when they are not able to. So if you found there was a week in this system that I myself found myself not going to bed to maybe 3, 4 o'clock in the morning, and this went on for a week. And the option was I could become very anxious over that, which would have just, created more anxiety about the situation. But I just understood, this is where I am now. And it's okay, So if I was up at 3 a.m., 4 a.m., I found something to entertain me, to watch television. And eventually my sleep cycle went back to normal. I don't want people just in this space of becoming even more anxious about just, oh my gosh, I'm not able to sleep, or, I've gone 2 days and I've been up to 3 o'clock in the morning. If it becomes prolonged, then again, this is the time to reach out to, mental health professionals to maybe help give you some coping strategies to help with the sleep process. But we have to be easy on ourselves, very easy on ourselves during this time. So exhaustion is another thing, aches and pains. So a lot of the physical manifestations that we feel with this going on, it can be fearful because a lot of these physical manifestations, such as aches and pains, palpitations, sweating, that people are reporting, loss of appetite, they could mimic the symptoms that COVID-19 actually have. So people can become very distressed about that. But understand that a lot of those reactions, those physical reactions, again, is a response to stress, and there are coping things you can do, breathing exercises, making sure. The biggest thing I want to just stress is that reach out to a mental health professional, reach out, ask a friend, and get your coping strategies, because plenty of them are working with individuals on just coping through this process, so you can be as well as you possibly can.
Thank you so much, Dr. Rose, for that valuable information that you just shared. I wish we had more time because this is certainly a topic that I hear about on a daily basis, being in education, especially with our babies, with our young students, just students in general and how they're coping with this time. So again, I thank you for sharing all of that information. And we will now begin our Q&A. So if you have not done so yet, please put your questions in the Q&A box. Again, you can find it by clicking the question mark at the top right corner of your screen, and we're going to jump right in. So our first question, Dr. Rose, goes to a point that you brought up about not denying your emotions and really expressing yourself and sharing and talking to someone, reaching out. I know that for so many years, it's been like taboo to reach out to a therapist, to a counselor, but I'm so glad that you made it a high point to say, please do that. Insurance companies are, waiving your deductibles. They're waiving all these other fees. Please reach out because this is impacting everyone. So can you share a little bit about, ways that people can really do that? What are some strategies? Because they're right now just frozen in a state of, I'm feeling this, but I don't know what to do. Can you share some tips on that?
So the first tip will be to arm yourself. And what I mean is that we've been educated on what we can do to lower the chances of us being exposed and contracting it. So arm yourself. You make sure you have your mask, make sure you have your hand sanitizers. You can even reach out to your employer and find out what measures they put in place, because most employers are putting together just handbooks or information for employees. That's employers' responsibility to make the employees feel safe when they come back. So arm yourself, reach out to your employer, because the more you feel as though things and measures are being taken that protects you, the better you'll feel.
Awesome. Thank you so much for that. Our second question is, how do you talk to your child about this pandemic, and what things should you share and what things shouldn't you share?
So when your children, first of all, you talk to your children when they ask questions. So if a child is not, if a child's not asking questions and they're going about life and you don't notice any, behavioral or emotional changes in them, leave it alone, But if either you notice that there's a level of anxiety about your child you typically haven't noticed, or the child is asking questions, you want to answer them age appropriately and just answer what they ask. So if they ask, what is COVID-19? You tell them what it is. You don't have to go through, there's 100,000 people that's died already in this country, and just answer the question. If more questions come, you answer those questions in an age appropriate manner.
Okay, thank you so much for that. The third question is centered around, what are my options? You talked about the insurance being waived, but what are my options if I don't have insurance? What can I do? Are there resources that I can tap into to assist me during this time that are free?
Absolutely. Absolutely. So there was just an article a couple of days ago. A lot of the colleges and universities offer free mental health services. And even during this time, they can be telehealth services. I know this was specifically regarding Wayne State University. So, contact their counseling offices, their psychology office, their main switchboard. They'll be able to connect you with the appropriate department for that. A lot of community mental health services will also offer low, either waive fees or sliding scale fees, or even free services for individuals who are uninsured or underinsured. So there are plenty of resources out there. Ask the questions. You can come online, ask me. I'll do the legwork and put more information up for you. But don't let the fact that you do not have coverage stop you from getting the help you need.
Awesome. Thank you so very much. And your point takes me to our final thought here, is that if you are experiencing any trauma, any stressors, you need assistance, please, and anytime, call 211. We are here 24/7 to assist you with whatever situations you need assistance with. Again, dial 211. Very simple. On your phone, 211. If you don't have a phone, but you have your internet access on your computer, go to unitedwaysem.org/211 and someone can assist you there. That's all the time we have for questions today. I believe you all can hear me. I'm unmuted. Can you hear me?
Yes.
Okay, awesome.
So Dr. Moulton, thank you so much for sharing information with us on the 6 stages of social distancing and isolation and for answering our questions. Please know that you're a great asset to this community. I've really learned a lot today, and I really appreciate you coming to be with us today. As a reminder, for those of you who may be experiencing a need, including mental health services, our 211 helpline remains available, as Mr. Sean said, 24 hours a day, 7 days a week. We maintain a running list of available services in the community and can connect you to the support you need. From food pantries to diapers to utility assistance, our team can help with the resources for you. To sign up for alerts about our future town halls or to view previous town halls, please visit unitedwaysem.org/virtual-town-halls. The website again is also located in the chat box. Our next town hall will be on June 5th at 1 p.m. on the topic of childcare. We'll go over the new recommendations for providers, what questions you should ask your child's provider, and how you can find childcare now. Before we sign off, I would like to remind you all to fill out your census. You can fill it out online, and it only takes a few minutes. I filled mine out a few weeks ago. It is just 9 simple questions. What you may not know is the census impacts everything from funding for nutrition programs to support for Head Start programs and even libraries. Find out more at Be Counted Michigan. So BeCountedMI2020.com. Come on, Michigan, let's be counted. Thank you so much for everyone for joining us today, and we look forward to sharing with you again next week. Stay safe.